Hello everyone, this is Dr. Julian Escobar at Conceive Fertility Center, and we'd like to talk a little bit more about cancer. One of the most common cancers that we'll see coming into the clinic are women diagnosed with breast cancer. Significant number of women with breast cancer get diagnosed before the age of 45, which means that not only you have to deal with this very tough diagnosis and health issues, but also they affect your fertility and your fertility options. So we would like to now share with you guys options that you guys have that hopefully will make your trajectory more easily to deal with, as well as your decision making. One of them is, what if you're diagnosed with either cancer or carrying a gene that you could pass on to the next generation, that also will increase the risk of cancer? Well, now we have PGD, which is a technology we can use to select out genes that we don't want to pass on. So we could help you prevent passing on that affected gene to your child. The second batch of patients or group of patients that actually we see more often are patients with a very recent diagnosis of cancer that can see in their very near future chemotherapy, which will affect their ovarian reserve in the future, or surgical interventions like removal of your ovaries or oophorectomy, or even radiation that can affect your pelvic organs. So for patients like these people, or patients who could or have a high chance of being in that situation in the future, we can help you by freezing your eggs or your embryos if you already have a partner. And that way you can kind of freeze your fertility, and then you can focus on taking care of yourself and battling possible cancer diagnosis, and then delaying your fertility in the future. Many of these women are able to carry in the future, and thus you can use those cryopreserved eggs or embryos for future use. However, some may have difficulty carrying or want to carry sooner than they're done with their treatment, and thus they could use a gestational carrier. And again, these treatments will allow you to do that. So although these will not fix this tough diagnosis, hopefully it will remove many of the pressures that they bring with themselves. Take care.